Start.
Hello,
Hello.
this is Dr. Gabra, the doctor in the medical clinic. Are you Mr. Donald Trump, 64-year-old?
Yes, doctor, I am.
So, Mr. Donald, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So, before we start, can I know can I know how you feeling now?
Doctor, I am not feeling so bad or so well. I had cough and I have shortness of breath. I came to your hospital and they said that I have cancer. So I am going to die. And how will I feel? I feel so much depressed that I am going to die. I have cancer.
I'm so sorry, Mr. Donald, for your feeling, but can I know why you have this feeling?
Doctor, I
You
have seen a lot of person in my life who had cancer and who died. I am going to die. And is there anything that can bring joy in my life?
So, Mr. Donald, can I know how much you know about your condition?
I had cancer. That is all I know, doctor.
So, Mr. Donald, no, I want to tell you that not every patient with cancer will die and will have deterioration of his condition. As I have information that you have been done all the investigation and it showed that your cancer can be resected and you intervene operation and your cancer was resected and there is treatment available. So why you have this feeling? Can I know, Mr. Donald?
Oh, doctor, I also heard that after giving the so thing that medication called chemotherapy, the patient sometimes can develop cancer again, and also their condition can become so much poor. They cannot eat, and they become so weak. They lead a very horrible life, doctor. I am afraid of that. That I am a person, and I will have to go through such pain. So I cannot tolerate that, and I am not interested in any treatment. I just want to die peacefully.
I appreciate your opinion, Mr. Donald, but Mr. Donald, every treatment has its own side effect. As you said rightly, the chemotherapy has a little difficult side effect, but this treatment is the best treatment available for your condition. And after you receive this treatment, this is the best option for your disease, and there is good chance that your cancer will improve and all your symptoms will improve. Are you with me, Mr. Donald?
Okay, doctor. And you are saying that I will have this pain, and after feeling those pains, pain of those medication.
Yes, Mr. Donald, every treatment has uh, some difficulty. You will need to have uh, line in order to inject the treatment in your blood channel. There is some symptom, maybe you will have some pain, but all will be under care of the team and they will treat all your symptom. Uh, and you will be observed by the best team who will follow you and give you all proper management. And the other side, if we leave the cancer without treatment, there is big chance that cancer will come again and it will relapse again and you will suffer again from the same circle, and maybe in that time there is no treatment available and maybe the cancer will spread to other part of the body and you will lose the chance of treatment. So, Mr. Donald, I encourage you strictly in this stage. The best treatment for you is the chemotherapy. If anything worrying you about the treatment, I can clarify more. Do you have any question about it?
Doctor, so you are you guaranteeing that? Can you give me the guarantee that I will be totally fine after taking those medication on
Uh,
multivitamin?
Mis- Mr. Donald, I'm sorry to tell, but nothing guarantee in medicine. But I can assure you that this treatment, the best available treatment, and you will have big chance for improving. It doesn't reach 100%, but you will have good chance of improvement. And this is the best treatment available at this stage. Leaving your disease without treatment, at that time, I guarantee the deterioration and a problem later. So, Mr. Donald, I want you to start this medication. Is that okay?
Doctor, how many times or how many days I will have to take this medication time off?
Okay, thank you.
Okay, so what was your task?
My task to explain the outcome of the disease and to ask why he doesn't want further treatment.
What do you think? How did you perform?
I, I I did my best to explain the treatment, possible treatment, and to explain the outcome.
Okay, and
Maybe I don't have enough
what
time
was
to
the
explain.
possible outcome?
The possible outcome without treatment, the deterioration and the relapse. And with treatment, there is possibility for improvement.
Okay, and did you find out that why he is not interested in treatment?
He he is afraid about the side effect of the medication.
And do you think that you have been able to give him proper assurance that what could you do for his side effect?
Actually, the time was short, so I couldn't explain every details about his worry.
But do you think that you at least you could give him the assurance that you will take care of that?
I tried my best that to assure him that we will follow all your symptoms and we will treat all complication and all side effect accordingly.
Okay, fine. So, and was there anything that afraid the patient for his further treatment?
Um, the only thing he told the side effect, the pain,
Okay,
the
and there was
complication.
another thing that patient had seen few patients who had cancer and died. So that patient thought that the treatment will not bring any good for him.
And I think I explained that there is a difference
Okay,
between.
okay, fine, thank you.
Thank you.
In this case, that you have done very well. That was fine. But I think you could have asked that patient was so much worried that he has seen a patient that cannot. So you said you could say at first that okay, your test reports shows that this can be we can do the surgery, we can remove the cancer, and after the surgery or after the operation, we can give you some medication so that will likely cure your condition. This, this cancer is very limited. Okay, so that means that you will probably be get rid of this cancer. Okay, and patient was worried for his side effects that patients develop so much anorexia, so much nausea, vomiting, weight loss. And for that, you could say that okay, that's actually this medication comes with some side effects, but we can make an arrangement with the cancer doctor so they can tell you in advance what could be the side effects and what can they do for you. Certainly, there are things that can also be done with the symptoms. And after you talk to them, you will better know about the those medication and their side effect and what they can do for you. And I think your fear will go away after that. Okay, this would
Mm.
give the patients confidence, because patients may have some misbelief that this is going to give me so much pain, so much nausea, and you don't know that is the side effects of the chemotherapy. Just you can say that I am going to make an arrangement with the cancer doctor, so they can give you the explanation what could be the side effect, what could they do for you, and we are always here to help you. We will take care of your every side effects. And after you talk to them, I think that you will be able to get real idea, and what is this medication, what is their side effect. Okay,
Okay.
just you try to discuss this condition on your own, that you are going to handle this. Actually, this is the uh, this is the work of the chemotherapist. We don't know that what type of chemotherapy they are going to choose for him. So they will choose certain type of chemotherapy, and they will say the side effects, and they will explain this to him, so his fear will go away, and he will get a hope that yes, you are taking care of his symptoms, that you are taking care of his symptoms he can develop due to the chemotherapy side effects. So he will get a hope that yes, you are so much nice, you are taking care of his symptoms, you are taking care of his concern. Okay,
Okay.
this was fine, so fine. You did very well.
Thank you.
Do you want to go for the next case?
As you